But here's where it gets controversial. Decades of routine beta-blocker use for heart attack patients may need to be reevaluated, according to a new study. Researchers in Spain and Italy found that these medications, often prescribed to slow heart rate and lower blood pressure, didn't clearly benefit patients whose hearts were still functioning well after a heart attack. This revelation challenges long-standing medical practices and sparks debate over whether the traditional approach is still valid. The REBOOT study, published in the New England Journal of Medicine, followed over 8,400 patients recovering from a heart attack, with heart function above 40%. Half were given beta blockers, while the other half received none. Over 3 years, no significant differences emerged in death rates, repeat heart attacks, or hospitalizations for heart failure between the groups. However, a sub-analysis focusing on 1,600 women from the original trial revealed an unexpected risk. Beta blockers increased mortality in women, while men saw no such effect. The study noted that the participating women were generally older, sicker, and received fewer treatments, which may have skewed results. Meanwhile, another trial, BETAMI-DANBLOCK, also published in the same journal, suggested beta blockers could reduce new heart attacks in patients with stable heart function. But the study had limitations. It combined 2 smaller trials, and eligibility criteria varied by country, potentially affecting results. Dr. Greg Finaro, a cardiovascular specialist, emphasized that while beta blockers showed promise, their benefits are likely modest, especially when compared to other therapies. Experts caution that the debate hinges on who qualifies for beta blockers. Dr. Stephen Pfau, a cardiologist at Yale, noted that REBOOT challenges over 40 years of standard care, which dictates starting beta blockers before or shortly after discharge. Advances in treatment, like better stents and reperfusion techniques, have improved outcomes, prompting some to question whether the old guidelines still apply. Dr. Jennifer Miao, a board-certified cardiologist at Yale, advises that if beta blockers are safe, patients should continue using them. However, more research is needed to identify which patients truly benefit most. The studies highlight a growing divide. While some see beta blockers as a valuable tool, others argue they're overused or ineffective for certain populations. In the end, the question remains, should heart attack patients stick with the old rules or embrace new evidence? The answer, experts say, depends on individual health profiles and the latest research. As the medical landscape evolves, so too must our understanding of how to treat those at risk.